Hello, it's Dr. Rhonda Johnson. Today's Friday, March 18th, 2022. Today I'm talking about that fourth booster shot. Well, you've probably heard that Pfizer's asked the FDA to approve a second COVID-19 vaccine booster in 65 and up, and Moderna has asked the FDA to authorize a second COVID-19 booster under EUA, emergency use authorization, for all adults. Now, Moderna is saying that adults 18 and up need flexibility, according to the CDC and their doctors, to determine who should get the booster. So what's the science? Most of the science comes out of Israel. There have been research studies in Israel that demonstrated a fourth booster dose of either Pfizer or Moderna gave a marked increase in antibody responses. And even if people ended up infected, they had very mild infection. So Israel, they gave the fourth booster to healthcare workers, immunocompromised patients, and people 16 up during their most recent Omicron surge. So back to the United States. What do we know? We know that people who are 65 and up, immunocompromised, who have underlying medical conditions, are at the highest risk of serious illness and death from COVID. So should you get a booster shot? Well, first and foremost, I recommend you talk to your healthcare provider. I suspect that this booster is going to be approved for high-risk people. It may be by age, it could be by job, occupation, and medical history. But if your doctor recommends you get the fourth booster, folks, I say follow your doctor's recommendation. But what if you're not in a high-risk group? Should you worry? I say probably not, because the currently available vaccines are being updated to target more of these Omicron and other variants, and it appears likely that there will be a new Pfizer Moderna vaccine by the end of this year. So continue your preventive precautions, but again, we don't know what can happen with these variants, so go with your doctor's advice if you're advised to get a booster. Now, what about natural immunity for those who had COVID? Now, if you had Omicron between December and February, scientists don't really know if your natural immunity is going to protect you against any new Omicron subvariant, because we're seeing reinfection with Omicron subvariants. That's not rare, folks. And if you've never been vaccinated, you've never been infected with any COVID variant, just know that your immune system is starting from scratch. If you get infected, you won't have existing antibodies or memory T or B cells waiting to fight off this COVID. And studies have shown that unvaccinated people are 10 times more likely to die. Sadly, during this last Omicron surge, we had many more deaths occurring in younger unvaccinated people. Folks, remember, the vaccine is not the enemy. The virus is the enemy. Get your vaccine. As always, my views are my own. Take care.